So it's a big welcome to Accelerating Global Health Progress, and we're going to look at how health systems can better respond to global health threats, and we're going to look at where are we on this road to universal health coverage so that we can actually make universal health truly universal. And everybody in the room will be very aware that the WHO Director General says they're two sides of the same coin, and I'm sure we'll be hearing a lot about that this afternoon. My name's Claire Dool, I'm the moderator. I'm here to guide the discussion, to make sure everybody is on time, on track, also to encourage you to tweet at #GlobalHealthProgress. So when you hear something exciting, please do tweet. It is now my pleasure, though, to introduce and to ask the Director General of IFPMA, Thomas Kueni, to open this afternoon. Please, sir.
We are delighted to host this event, and we are convening you all to discuss how can we work together. Because one of the themes of our organization, IFPMA, is really working together, building together responsive health systems, building a future in partnership. I would like to thank the global stakeholders who are engaging with IFPMA, and I've seen a real opening, a willingness to open doors, to leave the trenches, to forget about FENSA, as long as it is not about rule setting. And I'm very pleased that we have this afternoon Dr. Pete Salomar, who is very much on the front line, of course, of public health emergencies right now with the Ebola crisis in the Congo. And I'm sure that he will talk about his challenges. We're here together to help people live healthier lives. And I'm excited by the potential, how much we can get achieved if we are willing to leave our comfort zones, to move out of the trenches and work together. As many of you know, this year is the year of IFPMA's anniversary. It was founded on June 7, 1968, a time where Paris was under siege, as apparently it is again. Paris brûle, I told my friend Philippe Lamoureux, and we were founded on June 7, 1968, not in Paris, not in Geneva, but in Stockholm, which is known for more calmer environments. I think it may surprise many of you that this industry used the anniversary not just to celebrate and ask people to give us a pat on the back. We really wanted to stimulate debate, and we wanted to stimulate reflection of how we can do better and how we can do more. At the same time, also reflecting quite often, and for me, the best book I read this year was really Factfulness from Hans Rosling. Because normally, even when I talk to my wife, the world is getting darker, and the world is getting gloomier, and therefore it's from bad to worse. Not quite true when you think about global health and when you think about global health progress. Because over the past 50 years, we have witnessed monumental achievements and advancements. When you look at today's children receive routine immunization that prevent previously widespread illnesses as rotavirus, pneumococcal disease, polio, typhoid, diphtheria, measles, and rubella. Now, being Swiss, I'm always ashamed looking at the statistics of immunization of Switzerland. We have seen a resurgence of anti-immunization movements, not just in my country, where measles is underestimated as a potentially deadly disease for children, but also in countries such as Germany, Italy, or France. But we have also seen antiretroviral treatment, people diagnosed with HIV/AIDS. It's now become a chronic disease. And whereas 20 years ago, basically, you need to have the fortune to be born in a rich country to benefit from the treatment. Now you have more than 20 million patients in poor countries who benefit from it. And we have organizations such as Gavi and the Global Fund. Communities suffering from neglected tropical disease, they can benefit from the NTD initiative. A woman discovering a lump in her breast can receive treatment that is much more targeted. We all know that there are huge divergences depending on where you live and how close you are to a center. And I will talk about this a little bit later. Persons with diabetes, cardiovascular disease can manage their conditions through medication. Actually, in cardiovascular disease, literally for 2 cents a day, it has become extremely cheap. Someone with hepatitis C can get cured through treatment. I was recently in Astana at the 40 years Alma Ata conference, and we were talking about Hep C, which to some extent was, disruptive innovation at its best and at its worst. At its best because it can cure disease in 8 to 12 weeks, which was incurable before and which was fairly costly before. And now patient can be cured, which of course increased demand. As all new innovation upfront, it was fairly costly, which was very disruptive for budgets. And we learned some lessons too, but it's a cure and the treatment became much cheaper because competition came in very fast. We also have an experimental vaccine for Ebola. And I'm sure we will hear later about how WHO has become much more effective in responding to pandemic emergencies and health crises. I think it's truly amazing how far we have come. But equally amazing is the thought that the next 50 years promise to deliver an even more exciting era of medical discovery. When we look at our aging societies, and I'm always puzzled, Japan is the society which is clearly among the first world, the first, to fully know what demographics mean. A country with 125 million people, which will dwindle to 80 million in a matter of 30 to 40 years, where the Prime Minister actually has reached out and said actually the 100-year life is not just a threat, a risk, it's also an opportunity. Actually, in one extent, Japan has adjusted to that. When I was in Japan a few years ago, I read in the papers that somebody who turned 100 got a silver sake cup from the government. No longer, it's tin, too expensive to hand out that much silver. With more than 7,000 medicines in development around the world, we see the potential for additional breakthroughs. And I'm absolutely optimistic. There will be a day where we will have a cure, ideally prevention, for diseases such as dementia, diseases which I think frighten all of us. Discovering and developing the next wave of life-saving and life-enhancing medicines and vaccines is the core purpose of our industry. But we also realize as an industry, and that's where we really became self-reflective, that we have to do more. We are not just suppliers of medicines. We have to play a role in the health systems discussion. We welcomed the Global General Program of Work of WHO, where you do have a shift, to the broader systems discussion, where you do have a shift to the importance of mobilizing domestic resources and tackling health systems barriers in the broadest sense. And we want to be part of that. We are interested to be part of solutions and not seen as the problem. What I've seen over the last 2 years, and it's really an evolution of what happened in Geneva over the last 20 or 25 years, is a new area of public-private partnerships. When I was here as a young diplomat in the 80s, Geneva for me was the battleground of MNCs versus G77, of the good and the bad and the evil. Now in Geneva, I see people really who left their trenches, who open doors and reach out. We had a discussion, for instance, this year on the pandemic influenza preparedness program, and we had some initially differences of opinion in terms of what we expect, in terms of accountability, transparency, whatever happens with the money from the vaccines manufacturers. And on the other hand, WHO rightly had expectations of industry delivering up to its pledges. I was really proud when we reached an agreement that we should move from a transitional relationship, transactional relationship, to a strategic partnership. Because I think there's an understanding from us, as well as from our partners at WHO, that we need to work together, and we all have respective roles to play. We see significant societal and economic shifts all over the world. No longer are the poorest of the poor living only in remote parts of the world. The urbanization of poverty is happening everywhere, straining public resources and institutions that provide basic healthcare services. We see governments struggling to provide basic services. And when you look at the theme of Alma-Ata, the Astana conference, it was really about the importance of primary healthcare service. And I think we need to move together. We also need to think out of the box and reach out to partnership. While these societal shifts will continue to challenge our traditional approach to global health, we also see new trends simultaneously driving opportunities to better address the health needs of underserved populations. We have new technological advances, enhanced interconnectivity, the digital revolution, the cell phone revolution, the ability to transfer data from remote spots, which will make healthcare in many respects more effective and also cheaper. We see large multi-year, multi-company programs which provide opportunities for organizations to collaborate and leverage investments across similar areas, driving sustainable change and bringing programs to scale. I already mentioned the NTD collaboration. We also, I think, are seeing an increased recognition that improving access to health care requires a sustainable approach to strengthening health systems and moving towards universal health coverage. Because I mentioned the 2 cents a day for treating cardiovascular disease. But if you pay out of pocket, even 2 cents or 20 cents may be too much for a family which lives on less than $2 a day. IFPMA companies are involved in more than 300 active health partnerships in low and middle income countries, many of which facilitate access to medicines and strengthen health systems by addressing issues of infrastructure, capacity building, and awareness. I just briefly want to touch on 3 such partnerships because I think it's truly important, referring to the 50 years of health progress and saying that we don't want and expect pats on the back. We want to show that we walked the talk and we did leave the comfort zones and the trenches. I want to start with the first, Access Accelerated. We had this morning a workshop with many of our partners where when you look at NCDs, including cardiovascular disease, cancer, chronic respiratory disease, and diabetes, they are responsible for the largest percentage of global morbidity and mortality, 38 million deaths annually. The growing burden of NCDs is felt particularly in low-resource setting, and it is a huge concern. 80% of NCD-related deaths take place in low- and middle-income countries. If the rise of NCDs is not reversed, we risk losing progress in health and economic development. That's why the World Bank's focus on the Human Capital Development Index is such an important one, and that's why it's so important to make progress and demonstrate the investment case in spending on healthcare and investing in healthcare. To address this challenge, the IFPMA is partnering with 23 pharmaceutical companies, World Bank, UICC, on Access Accelerated. I think it's a first of its kind multi-stakeholder collaboration focused on improving NCD care. Through this cross-industry collaboration, we are moving from talk to action. We are working to transform traditional notions of public-private partnership. The goal of Access Accelerated is simple. It's to help achieve the UN Sustainable Development Goals, and in particular reduce premature deaths from NCDs by 1/3 by 2030. Working together, we find synergies and convening powers. Talking to the industry as a whole rather than just individual companies makes life easier for our partners in developing countries. And we have heard more than once that it makes such a difference if we, as convening partners, provide a platform where you have all those companies coming together rather than at 8 o'clock having company X, at 8:30 company Z, and at 9 o'clock the third one banging on the door of somebody who's actually overworked already. Working together, I think also we get more out than the sum of the individual actions. I'm happy to say that the initiative is starting to really bear fruit. We see in Paraguay the Union for International Cancer Control and the Cancer City Challenge brought together a multi-stakeholder group to conduct a needs assessment of the local healthcare system, which resulted in a draft law which the Senate has since approved that creates for the first time a national cancer control program. And I must say I'm very pleased to see Carrie Adams, the CEO of UICC here. I think we really, over the last 22 months, we developed trust by working together and by focusing on the city cancer challenges in Asunción, Cali, Kumasi, and Yangon. Ministries of Health in Ghana and Colombia have requested technical assistance we are providing through the World Bank to inform the development of national NCD strategies. El Salvador and Kenya are testing implementation of NCD services integrated into primary care. I think these pilots will inform nationwide scale-up of these services. We are very much interested in sustainable solutions. We also have a willingness to be held accountable because through proper monitoring and evaluation, we can and must increase the transparency as a public good and continue to improve our learnings. Critical to Access Accelerated is our ability to track progress and continuously adapt our approach. Knowing the CEOs, they are impatient people. For them, results should come yesterday and not tomorrow. Therefore, we also held accountable by people who really want to get results. That's why we do have independent measurement at our core by working with Boston University School of Public Health to develop a framework that rigorously measures and evaluates our programs. Our industry, whether it's about R&D or complying with regulatory requirements, strongly supports evidence-based approaches, and it strives to apply the same approach to investments in health partnerships. Thereby, we will learn from our mistakes, and let there be no doubt, mistakes there will be. A second example of an initiative which we launched last year is the AMR Industry Alliance. Our work we have done to address antimicrobial resistance, which has become an increasing threat as disease becomes resistant, reversing gains made in the last 50 years. A friend of mine yesterday said that the minister she needs to meet before Christmas is due for hip replacement surgery in a highly developed country before December. I wished him well because the biggest risk probably you face in a hospital is infection, antimicrobial resistance, and it can happen in Geneva, it can happen in Toronto, it can happen in Paris. We believe that the life sciences industry has a key role to play in the fight against AMR, which is why we responded to the UN call for concerted action by creating the AMR Industry Alliance. This is the largest private sector coalition to provide sustainable solutions to curb AMR, with more than 100 companies and associations from biotech, generics, diagnostics, and research-based pharmaceutical companies. The Alliance is a powerful convening force and has been able to deliver first results. It recently came out with a big environmental initiative about environmental discharge targets, which got the praise of Secretary Azar and the CDC in the US, because quite often the problem of the environmental impact also coming out of manufacturing is underestimated. Companies have also addressed the need for stewardship. and a number of companies have started to reward their sales reps for appropriate prescribing and educating the doctors rather than selling as many antibiotics as possible. And last but not least, our survey showed that the AMR companies, the private sector, in 2016 invested 4 times as much in the research for new antibiotics as all governments together. This is a bit counterintuitive because when you read the media, the impression is by and large the private sector has left the field. And I'm the first one to say that $2 billion spent is far from adequate. And I'm the first one to say I'm really concerned that this is not sustainable unless we get market-based pull incentives. We also launched a third initiative, which basically is quasi-impossible to communicate because patents are so technical, and although they are in the public domain, you sort of need an MIT PhD to understand what it is about. But we did team up with Viper, and we launched PAT-informed and also unique public data bank, which does provide consumer-friendly, easy-to-use access on 14,000 patents, 600 patent families, on 199 INNs in 7 disease categories. In short, what is it about? It is about making life easier for procurement agencies. We did some test runs, some trial runs. We were told that actually using the data bank can speed up procurement processes by up to 30%. And one agent said it means for him he can reach 4 million patients rather than 3 million patients. We certainly will test this, and we certainly want to be able to widen and broaden PAT-informed and show that it delivers and walks the talks. Last but not least, I think our industry needs to maintain public trust. And we will launch within the next few days our new IFPMA Code of Practice, which in some respects is quite radical, total ban on gifts, for example, which will enter into force on January 1, 2019. And it is about continuing and strengthening on global partnerships and IFPMA, which has been the beacon for the whole sector since 1982, when we adopted our first code of conduct. We know that the world is changing, and we need to change with the world. The code is the result of 2 years of consultation by the industry's leading experts on compliance, but with the full support of the CEOs. It will help guide and inform our day-to-day actions and ultimately contribute to building and maintaining the trust we need. We need this license of operate. While the most evident part of the R&D biopharmaceutical industry's work is the discovery of new medicines and vaccines that prolong and save lives, it also needs to develop, promote, sell, and distribute them in an ethical manner. And we are rightly held to a higher account than other industry. We are not selling luxury goods. We are not selling luxury watches in Geneva or luxury bags. We are selling medicines which can make a difference between life or death. And therefore, it is important that we live up to the expectations of the public. And I must say I'm really proud of the work which has gone into the development of the code, and want to thank the whole team internally, Sophie Mellis, supported by a broad team, Melissa Barnes, who is our chairman of our Ethics and Business Committee, because our industry, unlike any others, as I said, is held by higher standards. I will not say that mistakes there will not be in the future. I know there will be, but I think the code is something to which we will be held accountable. And if there are mistakes, I know, and that's change, it can bear on the market capital of a company. And companies are increasingly aware that actually investors are expecting ethical behavior. Now, our industry continues to learn and evolve, and we appreciate now more than 50 years ago the power of partnerships with actors across the health system. We are here today to build bridges among diverse global health actors. And as I said, we are willing to leave our comfort zone. We are willing to take risks in promoting partnerships champion positive outcomes, and demonstrate that this industry is willing to be a solution partner. I'm confident in our industry's ability to play a significant part in the next 50 years, delivering better health for everyone, everywhere. This confidence is rooted in three things. One, the ever-accelerating pace of scientific advancement. Second, the increasingly creative and successful private-public partnerships that are having a meaningful impact. And third, the fierce determination of organizations like IFPMA that we are committed to breaking down the barriers and finding real solutions to our biggest challenges. We understand that a healthy society is essential to ongoing global development because it creates stronger families and communities. It enables more productive and innovative workforces and supports economic growth. This understanding drives everything we do, and it drives the passion I see in my team. We are very excited about having so many different stakeholders with us this afternoon. We are looking forward to a very rich and lively dialogue on how we can step up and respond to the expectations, because we need to strengthen health systems. We need to do more and do better. As Dr. Tedros says, health security and universal health coverage are two sides of the same coin and the key to successful partnerships. Thanks a lot for having joined me here.